Good morning, Dr. Patino here at the Cosmetic Surgical Center of Cerritos. So we're doing high definition liposculpture on this patient, and in order to do that, to obtain this yellow, beautiful, almost white aspirate, you have to ask the patient not to take any aspirin-like medications or herbs or vitamins for 2 weeks before and 2 weeks after the procedure. The surgeon does not give any aspirin-like medications or blood thinners. And the tumescent anesthesia has to be given properly in all levels, sufficient amount, and we do these and we wait a good hour for the tumescent anesthesia to detumesce. And probably the most important part is to do the gentle strokes. This is an electric instrument, pretty much like a toothbrush, and you don't need to be going at it. If you are going at it, you cannot obtain this aspirate. It'll be bleeding. If you start right away and you don't put proper amount and proper placement of the tumescent anesthesia, they will be bleeding. So I'm going to be teaching how to do this bloodless procedure, which has many advantages to the patient. In addition to the lack of anemia, hematoma, infections, nodules, irritation, seromas, fibrosis, ulcers, and blowout fractures. All that can be prevented with this technique. Thank you. Ah, wow. So what is the color of that fat?
Yellow.
Yellow,
gold.
beautiful. Yeah, incredible. Thank you. Yeah, so if you want to get this yellow, beautiful fat, let us know. We teach courses here. To teach doctors how to do these, and the important thing is that this is the yellow fat. Pay attention. This yellow fat is what's going to go into her buttocks, and we don't process the fat in any way. The way it comes is the way it goes. So when we put this fat inside, it's going to be pure fat, and so that obviously you're going to retain all that fat. Your body's not going to shrink because it's pure fat. It's not fat and blood. It doesn't look red, it doesn't look pink, it's pure yellow fat. And that's what we specialize. Thank you. Liposculpture, we're doing the abdomen, and notice how we do this in a completely bloodless manner. So in order to get a bloodless aspirate like this down to the end of the procedure, you need to have the patient don't take any aspirin-like medications. The doctor doesn't give any aspirin-like medications, no enoxaparin, no heparin, nothing like that. And the patient has tumescent anesthesia with the proper volume of tumescent in all areas, right? And then the doctor starts an hour later to allow the tumescent anesthesia to detumesce, and that takes about an hour. And also the epinephrine works within 15 minutes, but we have found out through experience here that the longer you wait, the better. The last area that we do actually have less blood loss, which is opposite of what people do, right? And notice how the aspirate is still nice and yellow, right? And we are going to show you the pinch test in a bit so you can see how incredible this is, right? So I'm going to go into this other area and do the midline here, right? She had an abdominoplasty already, and now we're marking the supraumbilical linea alba, and we already marked the semilunar lines, and I'll show you the pinch test in a bit, but I just wanted to show you how is obviously the lack of anemia, hematoma, much less risk of infection, oil cysts, and even blowout fractures, which I believe are the result of the body rejecting the blood and or oil, the result of aggressive cannulas, aggressive liposuction, and bleeding. The body acts as these were foreign to it and rejects it, much like it would reject a bullet or a piece of glass. In medicine, we call these foreign body reaction. And it's similar to what happens with breast implants. When they encapsulate, is the result of the body rejecting not only the implant, but blood around it, or even infection, microscopic infection. And I believe the same thing happens in the buttocks. Thank you. Okay, so we're going to do the pinch test. So we are down to 0.5 centimeters lateral to the semilunar lines. You can see the pinch test here, right? And on the other side also lateral to semilunar lines, 0.5 centimeters. I don't know if you can see from there, Elena. And right in the middle, we have about 1 centimeter. I don't know if you can see. 1 centimeter pinch, 1 centimeter. And we're going to show you the photo from the side in a bit. Thank you. Right, so the patient is on the side, doing her waist, this area. But notice I'm using my non-dominant hand. And even for those surgeons watching out there who are not ambidextrous, this is very safe if you do it this way in a very controlled manner. My strokes are very controlled, right? So organ perforation usually happens when the surgeon is very tired, loses situational awareness, and goes into an unintended area, perforates an organ, something that has never happened to us, but we go very slow. It usually happens to a surgeon that's on his 8th or 10th BBL of the day on a Friday afternoon, going at full speed, sweatiness, right? And yeah, of course, there is going to be more risk because it's like driving a car, right? You're going maybe tired at night and going at full speed, and you go into an unintended area. You go off the road and you crash, right? The same thing can happen to a surgeon in the similar way. Thanks to God, we never had anybody die, and we never perforated any internal organs. And we want to keep it that way, but I would say it's almost impossible to do so if you do this in such a controlled manner with slow strokes. And in addition to that, look at the output that we're getting this way. If you go slow, you can get this beautiful aspirate. There's many things that go into it. We also keep our aspirator at very low speed, so we treat the fat gently, so we don't use aggressive cannulas. And so notice that there is absolutely no oil. See, if you go very fast with aggressive cannulas, you're going to break the fat. So if you go very fast, you can break the fat cells, right? And oil will be released, right? Also, if you use very aggressive suction, right? You put that aspirator at full blast, especially if you have a brand new aspirator. Those surgeons, we got one, and we got some oil because the aspirator at full speed can do that. So we prefer to use an older aspirator at lower speed, and we don't get that oil, right? Because if you get oil, what happens is the body can reject it. You can have an oil cyst, right? If you get blood, notice that beautiful aspirate, right? If you get blood in the aspirate, then what's going to happen is that the body's going to reject that blood. And you will have the famous blowout fracture because the body is basically rejecting that oil, rejecting that blood that's not where it's supposed to be. The blood's supposed to be inside the blood vessels. So that's really basically what happens, that the body starts pushing it out as if it would push out a bullet or a piece of glass that doesn't belong there. It creates a capsule around it. It's similar to what happens with breast implants. You get your breast implants that encapsulate, usually is the result of a little bit of blood outside the blood vessels that the body rejects. That's the way it is. Thank you. Oh, and look at the gorgeous waist we gave this lady, and this is what we call the pinch test. See, there is no excess fat anywhere we go here at the Cosmetic Surgical Center of Rosarito. Yet no bleeding. Thank you. Okay, so we're doing ultrasound-guided gluteal fat transfer here at the Cosmetic Surgery Center. So what that means is that I'm looking at the ultrasound and we're putting this fat graft where God put it in the deep subcutaneous space so that the patient does well with much less risk of complications. And I'm looking at the ultrasound, I'm looking at the patient, and we have multiple teaching centers through the World Association of Gluteal Surgeons. We're teaching doctors. We have about 35 countries of the very best gluteal surgeons in the world, and we're doing this under ultrasound guidance with zero mortality so far. Thank you. Alright, and notice the beautiful fat graft that's going into the buttocks. There is no oil in that fat graft because we aspirated it at low pressure and we did it soft and gently with slow strokes, and so the risk of oil cysts is much less. We're going to talk a little bit also about blood fractures. I have my theory about that. I believe that it's a foreign body reaction, and what happens is that the body rejects the oil, creates an oil cyst, and the body rejects the fat, rejects the blood, and it may result in a blood fracture.
Alright, so we're doing ultrasound-guided gluteal fat transfer. What does that mean? It means we're using an ultrasound during the fat injection. So we have Dr. Patino's cannula right here. We have the deep gluteal fascia right here, which marks the area that we will not be putting any fat. This is where the striated muscle is. This is the danger zone. Right in this tiny little space is the subcutaneous space where Dr. Patino will be putting fat. This is the superficial gluteal fascia, which is distinctive in that it has a break, so it's not just one clear line, it's divided. This is the patient's skin.
And so this is the cannula, and you can see I'm withdrawing it. You see the tip of the cannula, and focus on that tip. I'm going to give it a bolus. You'll see a gray area, that's the fat going in, and you'll see what happens. Nicola's going to describe it. 1, 2, 3, go.
Alright, so see that bolus of fat coming into the space, and it's pushing down on the deep gluteal fascia. It's already being pushed down, meaning that fat has occupied this space, and basically the pressure of the fat is pushing down on the deep gluteal fascia. That's why we see that.
Beautiful. I wanted to show you this shot. Is from the intergluteal superior incision and under ultrasound guidance. So I'm looking at the ultrasound as we go, but I wanted to show you that I basically, and I'm not going to inject, but I basically just fill through this incision the medial compartments and the central compartment. I don't go past to the lateral. I do that through the inferior gluteal incision and superior gluteal incision, which is, I fill this part out. And I believe what happens if you cause a blood fracture is that the surgeon passed this area into the superficial subcutaneous space over here. And that's why most of the blood fractures are here or here. And it doesn't matter if you come from another area. The important thing is that you stay in the deep gluteal, in the deep subcutaneous space below the superficial gluteal fascia. And I believe that the disruption of the architecture, in addition to what I believe is a foreign body type like reaction that rejects that oil and creates an oil cyst, or rejects that blood that you're putting in. Look at this is just pure fat, so no blood in there, so the body's not going to reject this. It's going to stay. And right here, just for demonstration also, I'm going to just show you the position of the inferior and superior gluteal vessels that get hit 80% and 20% of the time respectively. And so what we do, the ultrasound it's mandatory already in Florida and New York, and it will probably continue to spread throughout the states, and we're teaching it at the World Association of Gluteal Surgeons. So I'm going to do this under ultrasound. Notice the incredible amount of beautiful fat there. Thank you. Alright, so notice we're toward the end of the procedure, and notice the beautiful fat graft that's going into her buttocks. It's pure fat graft, hasn't been processed in any way. We just collected it in 500 ml of normal saline, and right now we're feeling the central compartment. Thank you. Alright, so we're almost done, and look at this most gorgeous yellow fat going in here. You see this yellow fat is already coming out. Time to stop on that side. We're about to stop on this side under ultrasound guidance here at the Cosmetic Surgical Center of Rosarito with Dr. Patino. This is the way to go. We're teaching doctors how to do this under ultrasound through the World Association of Gluteal Surgeons. Thank you very much for watching.